Hi, my name is Dr. Gourisankar Reddy. MD/DM Cardiology. I am the consultant interventional cardiologist of KIMSicon Hospital. Today, the world facing the biggest problem is the heart attack, that is heart stroke. This is mainly due to that coronary blood vessels, which is blocks happened in the coronary blood vessels to supply the heart muscle. So mainly due to this problem, the patient develops that heart attack or heart stroke. So what are the symptoms for a heart stroke? Generally, how it is the presentation? Generally, the presentation is like the patient is to be like of develop that the chest pain. The first and foremost thing is chest pain. The patient develops chest pain. The pain is like heaviness, like ఒక సిమెంట్ బస్తాన్ని మీద వేసినంత ఫీలింగ్ ఉంటుంది. The tightness, the heaviness. So the pain is sometimes it may go radiate into the left shoulder, it may go radiate into the jaw, it may go radiate into the back. So this is the classical presentation, like chest pain, some of the lightheadedness, the sweating and the nausea. These are the classical presentation for that heart stroke. Suppose if it is the elderly patients or women or diabetic patients, this presentation may not be classical. Sometimes they may present with epigastric pain, and sometimes he may have presented with breathing difficulty. So the presentation, especially in the elderly and diabetic patients, it's atypical presentation. So if the patient, if it is to be like of diabetic, hypertension, if it is to be more than 45 years old, especially the risk factors, those who have, if they have any pain anywhere in your chest or epigastric region or back pain, you should not neglect it. You should immediately go for near the hospital, take one simple ECG. One simple ECG gives lot of information. So for all patients, especially those who have chest pain and those who have especially that risk factors with diabetes and elderly patients, there is atypical chest pain, should immediately go to the nearby hospital, take one simple ECG that gives us a lot of information. And immediately, if it is to be really had blocks or anything is there, if you open immediately that vessels, so immediately you can save them your heart muscle immediately. That is, patient may not develop the heart failure and the future complications we can prevent it. So generally the heart stroke mainly it develops due to atherosclerotic. The most common is to be like of lipid atheroma, the cholesterol deposition. There are types are there, modifiable and non-modifiable risk factors. The modifiable means like we can change, like diabetes, cholesterol levels, hypertension, and we can modify these things. And non-modifiable factors like age and certain risks of the people we can't change. We want to change them. But modifiable things like diabetes, we can change the lifestyle, we can control the cholesterol, we can control the hypertension, we can control the diabetes. So we can prevent. These are the things we can prevent the cardiac. These are you can prevent it. You can prevent that coronary artery disease if you control all those things. So my sincere request is to be like of to everyone. I want to aware all the people is to be like, if you have any chest pain, any chest pain, if you have any doubt about chest pain, immediately go to nearby hospital, nearby any primary health center, any small center, take one ECG, immediately upload that some to nearby kimsicon group or KIMS group, any cardiologists are available in the group. Then immediately we can give feedback, immediately we can get back to you that what are the ECG changes immediately, what is this normal or abnormal, we can give you, what are the further investigations do you really want, do you exactly to suggest, we can give that exact information. Thank you very much.